I'm Antoni Chan, a consultant rheumatologist from Reading, United Kingdom, and I'm here in Eular 2024 in Vienna, reporting for Room Now. One of the big areas in terms of management of patients with inflammatory arthritis is the concept of treat to target. And what we mean by that is that we would set a treatment target, and this usually would be an outcome score, and we try to achieve this target using the therapies that we have. While this is widely demonstrated in rheumatoid arthritis and also psoriatic arthritis, it has been less demonstrated in axial spondyloarthritis. And there are reasons for that. Often there is a long delay to diagnosis, and also the definition of early axial spondyloarthritis until recently has not been defined. More recently, we've had some important publications. Firstly, the ASA's Eular Guidelines 2022 for axial spondyloarthritis has been useful in terms of the management and sequencing of treatments in order to achieve a treatment target. And secondly, the ASA's definition of early axial spondyloarthritis, which is symptom duration of less than 2 years prior to diagnosis. When having this information allows us to then set up a framework with regards to how to achieve treatment to target. Here at EULAR 2024, there is a very interesting abstract. It's an oral presentation 0152, and this is a study looking at the treatment to target approach and how this can be achieved in axial spondyloarthritis. We know that there's a diagnostic delay for up to 8 years, and also only more recently, the definition of early AxSpA has been defined as being less than two years. So using a tight control treatment to target approach, the authors of this study looked at a 52-week open label prospective trial where patients were recruited when they met inclusion criteria, which is a symptom duration that is less than 2 years. And these patients were then randomized to treatment within the treatment to target approach. They used the ASA's Eular guideline as the guiding principle with regards to management decisions. When patients were in the study, they were first given anti-inflammatory medication, NSAIDs. They were given 2 NSAIDs for 4 weeks, and the target was to achieve AxSpA, which is the axial spondyloarthritis disease activity score with CRP of less than 1.3. Or they would want to have an improvement of more than 1.1 in terms of the change in the AxSpA, and achieving a low disease activity of less than 2.1. So these were the targets, as in they were trying to achieve using the treatments, first starting with NSAIDs. If patients did not achieve these targets after they had the anti-inflammatory drugs, then they were put onto golimumab, 50 milligrams subcutaneous once a week, and these patients were then followed up. And the target this time, after commencing golimumab, was that the AxSpA would be less than 1.3 on 2 occasions, 12 weeks apart. If patients achieve this target of AxSpA of less than 1.3, then the treatment was stopped, and then they were followed up to see how they were having achieved this target. There were 55 patients recruited into the study, and the symptom duration was very short. So there were symptoms, the onset of their back pain to the time of diagnosis was less than 1 year. These were patients who, with a mean age of 28 years of age, just over half of them were male, so that 58.6% were male, and 86% were HLA-B27 positive. The mean AxSpA was 3, so these patients had active axial spondyloarthritis, and 76% of them had active sacroiliitis. And so these patients had active disease, and in order to achieve an AxSpA of less than 1.3, this would be a very big significant improvement in their condition. When they looked at the outcome, 34% of them were able to achieve remission with an AxSpA of 0.9, and this was a very good outcome, and another 21.8% achieved low disease activity. So in total, around 60% of patients in this study achieve um, a good outcome score based on the treatment to target approach. When they looked at the predictors as to what were the patient factors that allowed these patients to achieve clinical remission, the multivariate analysis showed that male patients were more likely to achieve a clinical remission, a low baseline BASDI on entry, and also not smoking. So these were important characteristics of patients who were more likely to achieve the clinical remission in a treat to target approach. When they also look at other outcomes in terms of flare-ups, so these patients who were followed up and if they had treatment and then the treatment was stopped upon achieving the treat to target that was set out, 84% of these patients had a flare in the trial. But looking at time to flare from stopping the treatment, in the NSAID group, this was a mean of 61 days, and in the golimumab group, this was 155 days. So there was twice and more longer time to flare if you're in the golimumab group compared to the NSAID group. So this is a very important study because it adds to our body of knowledge with regards to treatment to target, in particular in axial spondyloarthritis, where there has not been conclusively shown. But I think this is a very important study to kind of help us to understand. And secondly, also helps us to think about how we should be diagnosing and detecting these patients a bit earlier so that they can have this type of approach where 60% of them can achieve clinical remission or low disease activity state. So I think this is a very interesting and important study that hopefully will help influence and also shape our thinking with regards to treating to target in axial spondyloarthritis. I'm Antoni Chan, reporting for Room Now here at Eular 2024.